So I would be remiss if I did not mention that while I am presenting, this is very much a team project and has involved multiple faculty, an amazing administrative assistant with professional graphic design skills, which I think is pretty unique, and 2 different graduate students have helped with this. So we're going to have to rewind a little bit to 2018 to tell you about how this really came to be. And before I started my position in 2019, Dr. Michelle Grokey-Dewey, who is our health and wellness specialist for Extension, she and one of the other newer specialists in FCS did a tour of Montana in which they actually heard directly from agents and community members about what the most pressing health concerns were in their counties. And mental health, just in general, came to the surface very often, and then specifically farm and ranch stress came up as a very significant issue that people were concerned about. And so my first couple of months on the job, I didn't know it at the time, but they already had plans for me. My first couple of months on the job, Michelle and I wrote a Montana Healthcare Foundation grant to get funding for our Montana Ag Producers Stress Resources Clearinghouse. And we convened an advisory council who informed both the design of this as well as ongoing feedback about the layout, about the topics and the content. And so we had a wonderful crew of individuals with various proximities to agriculture who informed this. And we launched this in April of 2020. We weren't planning to launch it then, but we fast-tracked it because of COVID. And since we launched in 2020, we have had over 15,000 visits to the website. And we've done, a part of that is the marketing that we've done to get people there. So this is where we started, but around the same time, we had this idea because it was clear that people didn't want to show up to a community presentation and sit through a whole presentation about mental health, right? That was just not an acceptable format. And so people wanted to access resources anonymously and from the comfort of their own homes. And so we also had this idea of, well, maybe we could create an informal mental wellness conversation curriculum that would be used. We would leverage the close social ties that exist in rural communities to get community members to host these conversations in more casual settings like a barbecue or coffee or something of that nature. And the goal is to destigmatize conversations around mental wellness and to get people information and resources they might need. And we knew this was going to involve quite a bit of funding support, so we were thrilled when the folks at Washington State University in Skagit County asked us to join forces on RASSUP. And so we are one of the core institutions under RASSUP, and we wrote into our Montana subaward funding to develop this curriculum and put on trainings to get people trained in it. So that's the origin of how this happened. What the curriculum actually is, it is a customized standard deck of playing cards, and each rank has its own theme. So for example, ACEs, those are managing stress using the 4 A's of stress management: avoid, alter, adapt, accept. Let's see, so 5 is eat, that's nutrition, and we're gonna look into that one a little bit more closely. King, learn how to navigate the Ag Producers Stress Resource Clearinghouse to get more information. And then the suits correspond to particular types of information. So hearts are tips or suggestions for how you might integrate that into your daily life, or how does this apply? Diamonds are specific resources or tools, and some of those we developed ourselves, some of those already existed, and we just have like a QR code embedded and people scan that. Spades are facts or explanations about that topic. A lot of times, what is the connection to mental wellness? Why have we included this? And then clubs are discussion questions, because we want these to be conversations, so we've embedded these discussion questions to get people talking. And then, so that's the deck, and the intent is to distribute the deck to community members through social events. And then we want to train facilitators with the facilitator guide. And so the facilitator guide has all these tabbed sections, and the tab corresponds to the theme. And so the facilitators can go in here and find all kinds of additional information, sort of like the background research, because it is research-based. So if they get questions, they can answer those questions about it, and it's got all the links to the different resources that we used. So that is the curriculum. And we'll look at EAT. So this is all about nutrition, the relationship between healthy eating and mental well-being, and basic nutrition recommendations. So hopefully you can see the cards there. The 5 of spades, 1 in 10 adults don't eat the recommended vegetables per day. People who eat healthy foods live longer and have less chronic illness and disease. 5 of hearts, eat a variety of foods. When deciding what to eat, choose items limited in added sugars and sodium. And then we've got a QR code that takes folks to myplate.gov for more information about healthy meal planning and recipes. And then the discussion question, what does your daily diet look like? Where might you sub in more vegetables and fruits? So those are the cards, and then the companion pages in the facilitator's guide include information about the gut microbiome, the importance of things like fiber, including enough fiber in the diet, vitamin D, and so forth. And so that's just kind of a little sampling of what the curriculum's about. Oh, I forgot that I put these slides in here. Sorry about that. So you can see it's very visual too. We've got my plate on there. We've got a sample grocery list and the guidelines in a table, and some info on mindful eating. And so, it's pretty basic. It's not like it goes super detailed, but it's enough to get folks started. For our pilot training, we recruited through email listservs and social media, and a number of our pilot participants were referred to the training from their county extension agents. So that was a really effective way of doing it. And we initially had capped it at 10, but we had to expand it to 15 because something we didn't expect was a very enthusiastic response from our military soldier and family readiness specialists. We had 4 of them participate. It was a day and a half of training. Day 1 was mental health first aid. And we decided to do this because we thought, well, we're sending these people out into their communities to talk about mental wellness. We don't know that they have any kind of training to be able to do that, and we want to make sure that if we're asking them to talk about these topics with folks, that they have been trained to recognize signs of distress and to respond appropriately and effectively. So day 1, mental health first aid, and then day 2 was a half day, and that's where we really had them go through the deck of cards, look at them, see what the information was, and we went through each theme separately. So we spent about 10 to 15 minutes per theme to talk about that information so that they were familiar with it. And then the last portion of the day was sort of like a brainstorming ways that they saw how they were going to bring this back to their community. We've got, for our evaluation, we did pre-post surveys at the training itself, and then we've also got one of the graduate students, Catherine. She will be doing an in-depth case study in one community where she'll interview the facilitators as well as community members, and that will be her master's thesis. And this is just some initial data on our pre-post from the training itself. Positive, it's a Likert type scale, 1 to 10. So great improvements in everything except when you adjust for multiple comparisons. The ones that are not significant are number 2, I'm aware of existing mental health and wellness resources in my community. And then down here, number 4, I am confident in my ability to make recommendations and referrals to individuals regarding available resources. So those 2, there was not a significant change. And it was only 11 people, so it's a small, very small sample. As far as future plans, we've had tons of interest across the Western region, so we will be in December training our RASUP collaborators. 1 from each state will come to Bozeman and we'll get them trained. And Dr. Courtney Cuthbertson, who is at University of Illinois Urbana-Champaign, Courtney and Josie Rodolfi are the 2 PIs on the North Central Region Farm and Ranch Stress Assistance Network. And I sent Courtney a copy and they were just like, this is amazing. How can we adapt this for the North Central Region? And so they're looking into how they might use that within their states. So that's really pretty awesome. And then of course, our own agents, we want to do an internal training with our own county-based agents, and we're doing a little intro session next week during our our annual conference session. So we'll see how that goes. So if you have questions about RASUP or about the curriculum, you can contact Dr. Michelle Grokey-Dewey, or you can contact me. Doesn't matter, we're equally involved in this and equally invested, so reach out if you've got questions. Thank you.
I was going to ask a question. After the folks came in for training, I think you referred to them as advocates, did they have a commitment to you to go out and train, X amount of people over X certain amount of time? And
Yes.
How did you follow up with them?
Yeah, so we asked that they host at least 2 conversations in the 6 months following the training. And we did not require the military soldier family readiness specialist to do that. They told us in advance that was not something they'd be able to do, but rather they're integrating as part of their existing responsibilities, because they do a lot of training with families and youth and so forth. So yeah, so we asked about, we asked them to do the 2 in 6 months. And as far as follow-up, our graduate student, because she's trying to get one of those communities to host her for her in-depth case study, she has been emailing, trying to strike that balance between, you don't want to bother people, but you want to make sure that they don't forget that they committed to that. So yeah, great question.
Hi, I have another question about the facilitators. Were they paid volunteers, or were they?
No, we are not paying them. We reimburse them for travel. We paid for their food when they were there and their hotel, and we give them the facilitator guide for free. And then we also gave everybody 25 decks of cards to start with, but we have ordered literal hundreds of decks since then, and we've had requests from some of them, can I get 100 of these to give out at this event? And so it's not exactly the way that we initially thought it would work out, but we're trying to remain flexible and see the opportunity.